Hello, everyone, and welcome. I'm Kelly Rogers, Associate Editor for DevX, joining you from Montana. And we are here today to discuss a very important topic, which is how data can help mitigate the impact of COVID-19 on women and girls. And so already we know this pandemic has affected women and girls across an array of issues. There's been an uptick in gender-based violence, reduced capacity to earn a living, and in some cases, the complete loss of livelihood, which we know means the loss of financial independence for many women. At the same time, frontline health workers and carers for this pandemic, the majority of whom are women, are at increased risk. And there's also a decrease in access to certain services, including sexual and reproductive health care, for example. So in the midst of all of this, we know that researchers and policymakers are scrambling to collect and analyze data to gain a better understanding of the differential impact this crisis is having on women and on men. And I think more organizations than ever are probably willing to share their data, and potentially more groups than ever are interested in harnessing that data to inform their own gender-sensitive response, which we know is critical because we know how important data-driven responses are. So at the same time, we know that many organizations and governments just aren't necessarily equipped to be considered data-driven, truly data-driven right now. And maybe that's because they don't have in-house data expertise. Maybe that's because they're overwhelmed with all of the needs that are required right now by this crisis. And also, there's still a lack of sex disaggregated data. So I know, for example, only a handful of countries have shared complete data on infections and mortality by sex. And there's also a need for more mixed method data collection, which would give a clearer picture of women and girls' realities right now. So these are some of the major challenges that we're going to discuss today. And we hope to give you some really practical insight into what groups are doing now, and maybe how you yourselves can be better harnessing gender data and put it to use in your own organizations. And so we have a very knowledgeable panel of experts with us today to help do that. But before I introduce them, I did just want to make a few notes about how this hour will function. I want to introduce the live illustrator, Chris Shipton, who is with us today and will be creating art out of our words. So we're excited to have Chris with us, and we will be sure to share his screen throughout to see where he's at and what he's created. And we will also be sharing that illustration following the event with you. And a reminder to our audience, we will have time for a Q&A towards the end of the hour. So please, as questions pop into your mind, just enter those into the chat box, and we will be sure that those reach the appropriate panelist. And also, if you do have a specific question for a particular panelist, just note that and we'll be sure to ask them. Otherwise, feel free to participate online and engage in social media using the hashtag #GenderData. And I did want to note also that this is the kickoff event to actually a series of 10 online events that we are producing in partnership with Facebook. And the aim of these events really is just to create a better understanding of the gender-related issues highlighted by this crisis, and to help organizations understand important lessons learned about how data can be better used to help inform responses. And so we hope that you share this series with your network, because I think it could be a really nice way to share tools that are working and just create a dialogue within this community. So with that, I am excited to introduce our panelists, mainly because they are three people who I go to with all of my gender data questions when I'm reporting. And so with us today, we have Emily Corey Pryor, who is the Executive Director of Data2X. We also have joining us Tara Cookson, who is the co-founder and director of feminist research consultancy Ladysmith. And joining us as well is Papa Sek, who is the chief statistician of UN Women. So a warm welcome to our three panelists. I'm very glad that you could join us. Emily, I'd like to start with a question for you. And I actually have to give a quick shout out to Emily, because we decided yesterday on our call that we've known each other for 5 or 6 years now. And I'm pretty sure Emily was the first person who explained to me what gender data is and why this community should be paying so much attention. And so I thought, what better person to pose this first question? Emily, what can gender statistics tell us about how COVID-19 is impacting women and girls? Why should we be paying attention? Why do we need sex disaggregated data right now?
Well, Kelly, first of all, just let me thank you and DevX, the DevX team for having me. And also thanks to Facebook for hosting. And I'm glad to know that. I didn't know that story, that I was kind of one of your first calls back when you were starting this journey. I'm happy to have been going on it with you, and thanks for really staying the course and continuing reporting to this over time. I really appreciate it. For those I haven't met, hi, I'm Emily Corey Pryor. I'm from Data2X. I'm coming to you from Tennessee, in the southeast of the United States for our international listeners. And to your question, Kelly, there's a lot that gender statistics can tell us about COVID-19 and its impact on women and girls and really all people. One of the things that we know right now is that, currently we have at least partial sex disaggregated data for COVID-19 deaths and cases for 60 countries, which is representing about 75% of the world's population. The challenge, and you were pointing out in your intro, Kelly, that we're lacking a lot of this, and we are in terms of full coverage, right? But we do have some partial sex disaggregated data. But a lot of the countries that are left out here represent a lot of the world's most vulnerable populations, particularly those who are living in low-income countries. So there's clearly, a challenge in terms of the information that we have and the information that we don't have here. The gender data that we do have has shown that women and girls are facing really unique risks and vulnerabilities. You've already referenced that women are on the front lines of healthcare. We know, according to the WHO, that about 67% of the world's healthcare workers are women. We know, for instance, from gender data that worldwide women are more likely to hold low wage or informal jobs, and they face a greater risk of economic hardship due to widespread and prolonged shutdowns. We also know that at home, women take on a larger burden of unpaid care. So they're disproportionately affected by the school closures that are sending children home, or also are often responsible for care to sick family members or elderly family members as well. And of course, as you also referenced, as rates of gender-based violence spike during this lockdown, women and girls really are facing a limited access to productive services. And I think, one of the things I hope that we can really take away from this moment and from this panel is that, in my view, sex disaggregated data is critical in helping to combat this global pandemic. So we need it right now to track infection rates and monitor the immediate progress or lack of progress that we're having on addressing the emergent threat. We need it in the future to be able to tailor the long-term policy measures that we will have to take to alleviate these impacts of the pandemic on women and girls. And honestly speaking, we also needed it yesterday to help us prepare and to be better poised to act. So what I really hope is that we can take this opportunity as a community to really catch up on this and get serious about gender data to make sure that we have the information that we need to be ready to serve all.
Thank you so much, Emily, for framing that. And Papa, I'd like to go to you now to give us a sense of where data on the gendered impacts of COVID is strongest or most available right now, and where would you say is the weakest and the least available?
Great. Thank you very much, Kelly, and to you and Devex for inviting me to be part of this panel. And it's really a pleasure. It's a topic that is very close to my heart, and I think for most of you who know me, my work at UN Women has really essentially focused on that. And as I sincerely believe that data alone cannot change the world, but we won't achieve lasting change without it. And this pandemic, in my opinion, really goes to the heart of this point. It's all about data, as we can see. It's data on the impact, data on who is affected, where, how many patients, until the health system gets overwhelmed. How much supply of protective equipment do countries need? How much people are social distancing, and so on. And now I think we're just reckoning with the socio-economic devastation of it. Again, I think data plays a key role here. But I have to say that, again, at least from my perspective, I think in a lot of ways, in terms of gender data, this pandemic caught us a little bit flat-footed. Something basic. It took us weeks before we were even able to understand, to get the numbers on the numbers of women and men affected. So in the early part of this crisis, everything was just the numbers of affected without, the sex disaggregation, sex disaggregation that was needed. And thanks to some of the, some hard work that we've done with WHO, for instance, we've been able to produce some of those case numbers, and there are also other initiatives in that regard. But it came very, very, very late, essentially, and the data, as Emily has said, is still incomplete. We know that female health workers are being devastated by this crisis, but the data is still very hard to come by. And we know, for instance, of a lot of countries that do not want to publish this data because it is sensitive, and we have first-hand experience of that. The existing socioeconomic indicators that we have in a lot of cases are related to SDGs indicators, and we know that some of them, and many of them, far too many of them, in fact, are outdated, and which offer, I think, limited clues about the gendered impact of the crisis. So this is just to say that I think that the problems that we have been warning for years now, in terms of the lack of gender data, have definitely caught up to us with this crisis. What we've had to do is to scramble and to put a lot of energy into some initiatives that are moving forward now. Just an example, UN Women is working with lots of partners to produce real-time surveys in over 30 countries. ILO is now modeling employment data, giving us a better sense of what's happening in the job market. Tech companies are stepping up, offering both data, technical expertise, and computing power. So again, I think there's a lot that we still need to have, but then we are heading in the right direction. But once this is all over, I hope that we will be drawing the right lessons. Thank you.
Thanks, Papa. Can I actually ask you a really quick follow-up question based on that? I know that UN Women does a lot of work with governments and with national statistics offices to strengthen the capacity to collect and use gender data. And yet we're still caught flat-footed. So I guess I wonder, was this crisis just too much? Like, was there any way to be prepared for this?
I mean, nobody could have been prepared for this, not the hospital system, not national statistical offices, and so on. Because as we know, when it comes to national statistical offices, their bread and butter are, national surveys, census, which all require basically face-to-face data collection. Administrative sources are usually not developed enough, at least in the countries that are most vulnerable, to produce the information that we need. So one thing that we've seen is that, again, as you mentioned, we work a lot with national governments to strengthen their capacities and so on. But the one group that has been missing in this whole conversation about data actually are national statistical offices. Most cases, it's basically geographic data that is being produced. It's data that, is collected usually by, tech companies and so on. So I think a lot of the conversation actually has sidelined the very people who are in charge of data collection at the national level. Now, that doesn't mean that they are not important, because I think as the recovery hits, and we really need to pay a lot of attention to that, as the recovery starts, the institutions that will be asked to assess the damage in the entire system. And if we miss that boat when it comes to making sure that gender data is really integrated into that work, then I think we will be missing that basically a huge chunk of the recovery and efforts that are being made to rebuild economies and societies. So I think we really need to pay attention to that. And in my opinion, I think that's where some of the relationships and the work that we are doing really will come in quite handy.
Kelly, could I just come in on that point as well? Just to say, I mean, I just want to underline the point of the importance of national statistical offices. And I think that, you know, your question around, you know, could we have been prepared? I mean, I agree with Papa. I think the world has shown that they were not prepared, that we were not prepared for this, right? But I also think that what this lays bare is a really long-standing underinvestment in national statistical offices and in the kind of data infrastructure that's needed for consistent, measurable, accountable, trackable government decision-making. And I think, and I know maybe we'll pivot to this at some point later in the conversation, but I think that really represents an opportunity for the future. But this really this underinvestment has been going on, you know, for a long time. We did just last year a study with our partner Open Data Watch, really trying to understand the financing picture for engendering all of our data systems, all of the government data systems, and supporting national statistical offices as well as other agencies that are responsible for data collection and data production around the world. And we learned that we were somewhere between 140 million to 200 or 170 million to 240 million dollars under where we need to be each year to really have the kind of gender data that we need. So obviously that's a big gap. These are big numbers, but we spend a lot of big numbers on many other things as well. And so I think that there's really an opportunity for getting this right, because Papa is absolutely right that as things go down the road here, and as governments start wanting to ask questions and citizens start asking questions of governments about how they're going to recover, it's going to come back to the data. And those same national statistical offices who work very hard and are understaffed and all of those things, they're going to be getting hit with a lot of these questions. And it's going to be hard to answer because we, you know, haven't made the investments we needed over a series of decades. Thanks for letting me come in.
No, thanks, Emily. And thanks for bringing up investment. I think that's probably something that we'll get back into when we talk about the future of gender data as well. But first, Tara, I know that Ladysmith champions the need for multiple forms of data, including, you know, data that brings women's voices to the forefront. And I actually liked in a blog for UN Women, you quoted human rights activist and attorney Rafia Zakaria, who wrote, "Numbers never lie, but they do omit." And so I wondered what you mean by that, and how is Ladysmith working on collecting maybe different forms of data in country context right now?
Yeah, absolutely. So we come from a feminist research perspective. And that perspective holds that gender data is and should be political. It's meant to change the kind of status quo systems and structures that afford some people more power and resources than others. And certainly that kind of political data is what's needed now for a gender equitable response, recovery, and kind of building of a new, you know, future after this pandemic. And so we believe that women's voices and spoken perspectives should inform the policies, programs, and services that are meant to benefit them. And that requires qualitative data. And qualitative data can take a whole bunch of forms. So it can be interviews or focus groups, but it can also be like participatory video and storytelling techniques. And so then what does that afford us? So one, you know, talking to people about their experiences is exploratory. It allows for discovery and surprise rather than coming in with kind of a predetermined set of things that we're going to test for. It also shows not just if a particular program or service works, but also how, so the process of how we get to a particular outcome. And then why or why not, like why does it work or why doesn't it work? And that data is really important at the moment. So, we've mentioned already about gender-based violence and the kind of rise in gender-based violence in the COVID pandemic. Well, we knew about that because of more qualitative methods of data collection that were saying like, hey, women are actually experiencing a lot of violence in these shelter-in-place policies. And so Ladysmith, for example, is working in Colombia on the border with Venezuela on a project called Gender Data Kit. And within 2 days of the Colombian government imposing a stay-at-home order, we started getting messages from women telling us that their violent partners had returned home, if they had, left or gone abroad. They had turned home, they were losing access to vital sources of income. Within a week, we had migrant women who were sleeping on the streets because of kind of landlords wanting to keep fewer people in a particular house. And so this is also about helping to identify like intersecting inequalities. What else do we want to measure? There's a really cool organization that we've learned about just really recently, actually, called Mobile Vani. And they're working in India and crowdsourcing feedback through a voice-based platform from residents in hard to reach communities. And so, for example, they knew that a certain percentage of the population wasn't taking access of the free food vouchers that the government was giving out. And through the kind of actual voice stories, they were able to understand that it was actually people from marginalized castes. So it's this sort of stuff that helps us then understand, what do we need to measure through surveys? What do we need to tweak? And what's some kind of like nuance in the numbers that we're generating?
Yeah, thank you so much, Tara. Are organizations coming to you now to asking you how do we do this? And also, how do we do this safely? Obviously, because a lot of methods are kind of out the window right now.
Absolutely. So we've been convening with a lot of organizations that typically use like face-to-face interviews or focus groups, or that are also used to doing like telephone surveys. But if we take gender-based violence again, it's really hard to conduct a safe telephone interview if you're in a small confined space with a violent partner. So organizations are really thinking about like, how can we pivot? What can we do? And they're looking to digital technologies also as a way to kind of gather data that they maybe wouldn't otherwise. And the tricky bit here is that we don't actually have all of the kind of gold standard yet for privacy in digital data collection methods. Like, nobody's figured it out. And certainly that's not a reason to kind of like scrape the bottom of the barrel and try to get away with and collect as much data as we can. It's actually an opportunity within this, I think, pandemic, with so many people focused on this, to say, okay, we need to set the bar as high as we possibly can. We need to draw on the tools already available to us, like the UN High Commissioner on Human Rights, in 2018 set out this really important framework for upholding the rights of all people, including women and girls, in data collection. It's not specific to digital technology, but we need to be taking those insights and thinking about it. One thing that we're doing with Ladysmith is exploring the idea of participatory consent and privacy policies. So what does it actually mean to design informed consent and privacy policies with the groups that you're intending to serve or collect data with? That's something that we're piloting in Colombia, and I actually kind of want to throw it out to the audience. I know we have a ton of people in the audience that if anyone else is sort of thinking about this, what it means to do informed consent and data privacy from a feminist perspective or participatory perspective, to please reach out to us at Ladysmith, and we'd love to kind of chat and crowdsource ideas.
Thank you so much, Tara. And I do want to get deeper into privacy as well. So I'm glad that you brought that up. First, I wonder if we can share Chris Shipton's screen really quick to see how his illustration is coming along. That looks great. Thanks so much, Chris. So while we are admiring this art, Emily, I wonder how Data2X is using its collaborative model to ensure that responses address the needs of women and girls. I know that, you know, Data2X is very collaborative. You have a wide network. What sort of needs are you hearing from your network, and how are you responding?
Yeah, well, thanks for that. And Chris, I'm loving the illustration. Much respect to you. I wish I could do that and have that talent. So yeah, Data2X really at our core is we're a collaborative, both technical and advocacy platform, and a partnership platform for action on gender data. And you know, one of the things that we have, and one of the things that we've kind of been since our founding in 2013, is trying to be a connector and trying to be a resource for the broader community. We're a global civil society organization, and so what that means is that we kind of have some independence, right? We're not government, we're not an agency, so we're able to kind of sit in the middle and be a resource for all of the different stakeholders who are interested in gender data. And so as this was all progressing and more resources were coming out, and people were trying to kind of keep track of all of the gender resources, but also some of the data resources and sometimes gender data resources, we really were hearing from people that they needed a place to find the information because of course it's just changing day by day. And so one of the things that we did was we created basically a gender and data related resource list, which is in our resource center on Data2X. You'll see a resource center button up at the top. And we've compiled there, and so much credit goes to the team at Data2X. We've worked really hard on this, of really trying to highlight all of the different organizations who are making calls to action for gender data related to the pandemic. And we've been publishing those and including those on there in order to amplify those recommendations. We've also been putting there things like gender data trackers that exist. So UN Women's is a great example of that. And I'm sure probably we'll talk about it, but also wanted to give a shout out to Global Health 50/50, which has really done an amazing work, amazing job of collating and tracking country-specific live sex disaggregated data in terms of cases, transmissions, and deaths. So we have a whole section that talks about gender data trackers, and then calls to action, and then all of the pieces of this that have different elements of gender associated with it. So putting into one place some of the latest around things like, feminist perspectives, all of the conversation and really important dialogue that's happening on care work, thinking about the impact on and collating resources on the impact on women in the LGBTQ community and other vulnerable communities, gender-based violence. So there's multiple topics. So it's a great place to go. And we really were hearing that so clearly from the community that they needed that. And so that felt like something that we could really do. And one of the things, there's two other pieces here. So like I said, we have both a collaborative approach from a technical perspective and an advocacy perspective. And on the advocacy side, we really have been paying close attention to what are the calls to action that are really coming out here, and what opportunity does that afford us? And one of the things that we're seeing consistently from all of the calls to action from multiple organizations that I won't list, but we have them all listed on the website, is that really gender data is going to be the bedrock of any responsive policy measure here. So this is going to mean that we need gender data across a very wide range of COVID impacts. So we're talking about migration and human security, to economic welfare, to unpaid care, to education, so, and obviously to health, right? But I just think it's really important that as we all think about responses, that we're understanding, that there's a whole chain of effects here, both immediate and long term, and that we really are going to need to have the data on all of those different elements in order to come up with the right kind of policy responses. And on the technical side, in addition to really kind of, like I said, gathering all these existing resources and making sure that they're very easily accessible to all, we're also working with our partner Open Data Watch to see, we really took a look at where could we add a value here ourselves on the technical side as well. And so we're focusing some efforts on understanding what gender data is currently available and then what is missing. And so we actually have a forthcoming analysis with our partner Open Data Watch that's looking at internationally available data for all countries. And what we did was that we considered, how could we whittle down to a smaller set of indicators to understand what's really essential to measure in order to understand all of these different gendered impacts of COVID-19. So like we've talked about, this is a health emergency, it's an economic emergency, it's a social emergency, all rolled into one. And we have to understand the data story here for all of those different aspects of life. We have to know what data we have and what data we don't have, as that's going to affect government's abilities to respond. And of course, our ability to do that analysis really relies on the network that we have and the relationships that we've built over time with different, agencies in different countries, different governments, and keeping an eye on the space and understanding what the latest research is really coming out, so that we can have the opportunity to try to put this all in one place and to say, okay, as we look at all the different aspects of this emergency, what are the things that we need to measure? What are the gaps that we need to fill so that we're all poised for action?
Thank you, Emily. And speaking of, what are the needs we need to fill and what are the gaps? Papa, I know as the head of statistics for UN Women, people in your agency have turned to you quite quickly and your team to provide data on the impact of COVID on women and girls. What has been your approach and how did you manage to shift your operations to do that?
Yeah, so I think, we've been fortunate enough that for the last few years, we've been running a large global program called Women Count, where basically we've been working in very close partnership with several actors, particularly national statistical offices, and already had several systems and partnerships that were in place to be able to work fast to produce data. Now, as I mentioned, we were also caught off guard, and not only were we all confined at home all of a sudden, but our partners also, who were for the most cases at home as well. And some of the surveys that we even had that were started were stopped quite abruptly because of the stay-at-home orders. So again, I think when the call came from our senior leadership, we really had to be very creative in the sense that having a global team, I think, really helped. In most cases, we had to activate some existing relationships, particularly with national statistical offices, looking at phone survey banks that they have, and working with them to reach out to service providers, particularly telephone, internet, and so on, to really start looking at what we can do together. And I have to say, we had to do some things that were simply unthinkable 3 months ago, such as conducting a rapid assessment survey that we know from a sampling perspective can really be challenging, and in a lot of cases incomplete, because you rely on access to a phone where there are, I think, some real gender related concerns there. We also those were some of the things that we needed to do to adjust. But one thing that I have to mention that is fundamentally important, and we don't always think of it as data, is basically looking at countries' responses and fiscal stimulus packages. Are they integrating a gender perspective? what policies are being put in place across the board in order to respond to this crisis. So, I think that's a tedious exercise of analyzing, what the text of policies and so on, and really to try to put it into something that can be easily digested. And those are some of the things that we had to do. So, if you go to data.unwomen.org, you will find quite a lot of this work that is already there. So the data on the health impact is already there. We've been publishing some of the rapid assessment surveys. We have quite a lot of SDGs indicators in policy areas that are important that we've made available as well. Research blogs. We're really, trying to grapple with how do we safely conduct ethical violence against women surveys in the midst of crisis and so on. So again, really quick and nimble operations allowed us to do it, but then we're still in the midst of that process, if you will.
Thank you, Papa. And you mentioned, I suppose you mentioned the rolling out of rapid assessment surveys. And I wonder if you could tell me a little bit, not only about what you found, because I know there are preliminary results, I think, from Asia Pacific now, but the process of rolling those out.
So on the process of rolling those out, essentially, there were two things. One is that we needed a sampling frame. And that sampling frame essentially can be, some countries, some national statistical offices, for instance, do have those phone banks where basically you can tap into that and use that as a sampling frame. But we also found that most of the developing countries that we work with actually do not have those in place. And that's why I think one of the lessons that we're drawing on from this, that in order to build that better, those things that were missing from the beginning need to be added. So we worked with quite a lot of service providers, so phone and internet in Asia Pacific, for instance, where from a random sample of respondents, 3 million respondents were selected, and a survey was sent to them. And once basically people opted into or in or out of that survey. Now, one of the challenges from that is that basically your sample is not truly random. But at the end of the day, I think if you're conducting a survey at this point, it will be biased in some way, shape, or form. So I think for us, it's really looking at the aggregate results rather than reading too deeply into it. And I think the results that we've seen are consistent across countries, I think, telling us a really nice picture on how, gender is really being, the gender consequences of the COVID crisis. So, these surveys are available at data.unwomen.org. And if you go there, I think you'll see essentially some of the initial findings. And we have, more surveys that are coming up in the next few weeks. So again, I think lots of lessons on what we can do. But also, going in the future, what is it that we will need once economies open up again, what kind of data we will need in order to validate the findings that we have during these rapid assessment surveys. So that will be absolutely critical, in my opinion.
Thanks, Papa. And Tara, I know the tech aspects of this are in Ladysmith's wheelhouse. Ladysmith recently released a report showing that there needs to be more collaboration between tech companies and NGOs working on these issues. And so I guess I wonder where you think the most potential lies in using unconventional data, let's say, to help inform the response for women and girls.
Yeah, so tech companies produce a lot of data, and Papa often says, like, the big tech companies will invest more in data than many national governments do. So they've got not only like a lot of data science expertise, but they've also got a lot of processing power. And there's teams within these tech companies that are trying to figure out ways to contribute their sort of data resources for good, including for the achievement of gender equality, and right now in the kind of COVID response and recovery. But really using that data to produce insights that are useful for feminist service delivery and advocacy organizations requires another kind of expertise, and that comes from those organizations themselves and feminist researchers that are really kind of at the forefront of understanding different gender dynamics. But these two kind of communities rarely sit at the same table. And so the report that we wrote and that was commissioned by Facebook dug into not only where like collaboration was needed to bridge data gaps, but also what was needed for productive partnerships. And we identified 4 kinds of ways that the tech community could contribute. And this was pre-COVID, but these kind of avenues or vehicles are also relevant now. So we mentioned earlier that frontline kind of service delivery organizations were struggling because they weren't able to collect their kind of conventional methods of data collection. So for example, to gain insights to help understand women's experiences of gender-based violence, or how to reach women who aren't able to leave the house to collect their cash transfer. So tech companies could contribute, one, by sharing privacy preserved, internally held data. So for example, like what can we learn from women and men and boys and girls behavior online at the moment when so much of our lives have moved online. 2, they could help process externally held data sets. And certainly Facebook has done this in other crises with their high resolution population density maps, and partnering with humanitarian organizations to not only be prepared for a crisis, but also to respond, to understand where are people, where do we need to direct the services. And those can have a gender lens if we're thinking about, okay, you know, we know that women aren't having access to dignity kits right now for menstrual hygiene management. So where do those, you know, really need to go? Where are people? They can also develop new products and tools. This webinar is one example of that, kind of like getting the word out, you know, sharing information about existing data collection tools that could be repurposed for achieving gender equality within this context. Tech Change is also doing a lot of really cool stuff in this area, and I'd encourage people to check them out. And then finally, on kind of the lending out of resources more broadly. So data scientists are really, really expensive. And your organization, your average kind of organization that's focused on gender equality is typically grossly underfunded. Like even if we just look at the kind of crisis sector, humanitarian sector, only 0.1% of humanitarian funding goes to addressing violence against women and girls. Yet we know that violence against women and girls happens in every crisis. So, you know, organizations that are looking to make use of these kind of new and unconventional data sets aren't able to compete with Google or Apple or Facebook or LinkedIn or whatever for data scientists. And most governments aren't either. And so this is relevant to Papa's point about national statistical offices really being kind of left out of this. So in the very kind of immediate crisis, we've sort of said like, look, we could look at secondment programs. You know, there's a lot of data scientists out there that work for these tech companies that right now are really wanting to like, you know, make a difference and contribute and like resolve all of this. And those data scientists could be seconded to organizations that have a social mission. But over the long term, we're going to need more kind of sustainable resources thrown at this, like through, you know, taxation, et cetera. So, you know, there's kind of a take your pick menu there of a number of different ways that partnerships could kind of come to fruition.
Thank you so much, Tara. And I know our audience has a lot of questions, so I would love to actually switch to Q&A. And let me just take a look at what has come in. So I know we've talked a little bit about gathering GBV data during lockdown, particularly. So we've had a few questions just considering the rise in gender-based violence during lockdowns. we know that gathering information on this issue right now is very sensitive. So what do you feel is lost by the inability to conduct interviews and interventions under these restrictions? And what measures can we advocate for as societies begin to reopen? And there's kind of an accompanying question, which is, can alternative data sources help fill these gaps? And I wonder, I know all of you could probably speak to this, but maybe I'll start with Papa on this one.
Yeah, thanks, Kelly. So again, I mean, that's one of the areas where we have the biggest challenge. And our executive director recently called it the shadow pandemic, in the sense that I think the initial data that is coming from, particularly from call centers and from police and shelters and so on, is horrific. I mean, you see basically increases of around 30%. And just, I think the anecdotal evidence that exists is I think tells a big story. And so I think, for us, it was looking at already, existing data, which is somewhat outdated, prevalence data in particular, but also, that's where I think administrative sources are really important, and the fact that we really need to invest in them. Because again, you may not be able to collect prevalence data, but if you understand what's happening basically, how's the police station, how many calls are they getting, shelters and so on, I think that gives you a big picture on what's happening on violence, and also who's, where do you have the biggest risks. So if you have, again, if you are ready, and as a country you have those monitoring systems that are in place before the crisis hits, when the crisis hits, it's easier to collect that information. Now, one thing that I think we've been able to do, for instance, from a data collection point of view, is look at service providers, right? So what are the challenges that they are facing? Because, in a lot of developing countries, for instance, where, perhaps shelters and so on are not as common, or reporting of violence is not as common, what's happening is that you have basically a dual problem where not only less people are reaching out for support, but the very people who are providing that support are facing immense challenges, and that's usually NGOs, civil society organizations. So you have a double whammy where basically, there's greater need on one hand, but less ability, a lower ability from service providers to respond. And usually this is where governments have not been around. And the surveys that we are finding are really, the surveys that we've been conducting with civil society partners in particular, I think, are really showing that vacuum that exists now when it comes to violence. And our hope is that basically this is not going to be a permanent gap that exists. Because if these civil society organizations do not survive the pandemic because of resources and so on, I think we will see really a deterioration of the situation that is unthinkable.
Thank you, Papa. We're also having quite a few questions on free data collection platforms. So amidst lockdowns and social distancing during COVID, which one is the best remote data collection platform that is free source? And we also have a question, this one is directed to Tara, so maybe you'd like to take them both. Would also love to hear if you have any other examples of remote data collection tools.
Yeah, so there's a bunch of them out there. And as I mentioned earlier, we've been convening with organizations to sort of think about how we can pivot, how we can use tools. We're not collecting like prevalence data or the kind of data that national statistics offices need to be supported to collect, but we're figuring out ways to use digital technology to collect data that alerts us to like patterns and issues, things that need further measurement, etc. A lot of organizations, including my own, are using WhatsApp. If you go to genderdatakit.org, you can find out a little bit more about what we're doing. We're happy to chat offline as well. And if you look at organizations like PRAKELT or TURN that are helping term kind of coming out of PRACALT, but helping organizations use WhatsApp as a data collection tool. Like, we know that people are using it, certainly in the context of Colombia, where we've got a project going at the moment. We know that's how people are figuring out, where do I get my cash transfer? What clinics are open? What are the changing kind of public policy protocols around quarantine? So that can be adapted, and that's really about meeting women where they're at. Like, what tools do they already have in their hands? Others are analyzing kind of public posts. Certainly we know in Zika, researchers were analyzing posts on Facebook to try to find out about dynamics about the spread of the virus. And then there's others. So I mentioned Mobile Vani. Humanitarian OpenStreetMaps is doing really awesome work in Peru, mapping where the kind of gaps are in service provision, where are people struggling to get food vouchers or cash transfers, etc. So there are a whole bunch of mechanisms, and they're not perfect, but they're really providing really fast insights, like real-time insights into, like, okay, what's going on.
Thanks so much, Tara. Emily, I have a question for you. So far, what data exists on the impact of COVID-19 on women, and how can we access them? And I'm sure maybe you'll want to mention again the resource that Data2X has created, but perhaps there are other resources as well.
Yes, no, happy to do that. So what information exists? Well, so do want to point you again towards the gender data trackers that exist, both the one that at UN Women that Papa referenced, data.unwomen.org. Papa, I think I got it right. And but also Global Health 50/50, their tracker as well. There's, in terms of thinking about the COVID-19 impacts and on all of these different types of human experience. So again, looking at education, looking at economics, looking at social protection as well. This is some of the research that we have that's forthcoming. Hopefully it's going to be out in the next couple of weeks, where we're really taking an important, I think, doing an important effort to put all of that information in one place in terms of what is currently internationally available right now. So all of that information is open and available, but what we're doing is trying to pull it together in one place to make understanding, the current status a bit easier for all of us.
Thanks, Emily. I'm just sifting through many questions right now.
Definitely. I can keep talking if you need some time to sift.
Yeah, really.
I just want to give you time to get to questions.
I appreciate it. Well, I think this is one that you all sort of mentioned tangentially, and I think we should get a little bit more into, which is policies to protect women users' information. So what specific policies exist to protect women's users' information? And if they don't exist, how can their formulation be supported? And I don't know if anyone wants to jump in on that. Papa, I know UN Women does a lot on privacy, so.
Yeah, so I think in the area of official statistics, we've come far in terms of, there are some very well established principles. So the fundamental principles of official statistics that really deal with, all issues related to privacy, how do you handle the data, and so on. And I think countries have been trying their best to actually make sure that data is anonymized before it is released. That you really cannot identify people in surveys. I think there's a lot of communications that is shared by national statistical offices and so on before surveys are conducted and so on. I think outside of the official statistical system, that's where we have a little bit of a mixed bag, if you will, where in some cases I think privacy is taken seriously, in others it's not, and and some of those I think do create quite a lot of challenges for women, and particularly issues of consent. So what does consent mean, for instance, if you're going to use my data on a web platform, for instance? And just recently, right before the pandemic hit, we had a very interesting conference in New York. And actually, I think both Emily and Tara were actually panelists in that, discussing the very issue of privacy with the UN and the UN Special Rapporteur was there. And I think there were some really interesting conversations and materials that were shared. And again, we have, if you visit our site, again, the data.unwomen.org, you will see the conference, which was called Counted and Visible. And, some of the conversations that are happening there. And I think we're, in a lot of ways, we're really still in that conversation. So, and a lot that needs to be done in order to make sure that women's information is actually protected.
Thanks, Papa. There's another question on how organizations without the data or resources or processing power that Tara mentioned can best utilize the data publicly available. So I wonder if that's one for you, Tara.
Sure. So, I mean, there are organizations that have like volunteer programs where a volunteer data scientist will partner with a small organization that may not have kind of in-house data expertise, et cetera. And those can be really great, especially for smaller projects. They're not as helpful for kind of like long-term projects, building up the infrastructure and capabilities of an organization. Certainly, I know that this webinar series is going to plug it, I suppose, is going to be developing a number of other webinars where currently available data collection tools are discussed and made useful. And certainly over the past year, I've really had to skill up on kind of understanding how the population density maps that Facebook produces work, for example. And I feel like if I can do it, so can anybody as an ethnographer by training. So I think it's taking advantage of some of those sorts of things as well. I'd check out Tech Change that does a lot of kind of learning and educational stuff around it too. But more broadly, I think we just really need to be advocating for the allocation of sustainable and unrestricted resources to feminist organizations so that they can make use of available data and also focus their resources on answering the questions that matter the most to them as kind of experts in the particular field.
Thanks, Tara.
Yeah.
Emily, you look like you want to
No, I mean, just I know we're running tight on time, but just to say, I think I love Tara's last point around making sure that there's ongoing funding and support for civil society organizations all over the world who are doing this work. And there are groups that can help in terms of data scientists connections. DataKind is one that comes to mind that works with, I know, a lot of civil society organizations on data science. But I also think it's Tara's last point of you might not think of yourself in the organization where you sit as a data person or as having data capacity, but what and what your expertise, which is so important, is knowing the kinds of questions that need to be answered. What are the questions that we need to ask of our data? Because that's something that, the data is only as good as the use to which we put it, right? And so we need the right questions and we need the right leadership. And I think it's thinking not only about what you can do with data, but what you need to be saying about data, right? How you need to be advocating for mobilizing a diversity of voices in the data conversation. We all know data is about power. We need to make sure that there is gender and racial and ethnic diversity in terms of how we're talking about the data that's collected and the way that data is used. We need to be calling attention to those things, and we need to be looking at it on all sides of the pandemic, whether that's the way that data is used within your specific organization or the concerns or questions you might have around how women, for instance, are included in the data that's collected and in the actions that are taken as we look towards the kind of future horizon of recovering from this pandemic.
Thank you, Emily. I know I said I would get back to what the future looks like, and then we never did. So I appreciate you getting that in. We are running short on time, so I want to close with just a final question. And if I could just ask each of you to answer pretty rapid fire with your thoughts. And that is, Emily, you started by saying that, we needed a lot of this data yesterday. Like, this is urgent. So what's one thing that could move the needle on progress immediately during the pandemic when it comes to gender data?
Do you want me to go first?
Go for it, Emily. Yeah.
Okay. Okay. So, I mean, sex disaggregating data, sex disaggregating on all the data that's collected on COVID and reporting it, making sure that we're increasing the frequency of data collection and using disaggregated administrative data and making more data open and widely accessible. I think we have to not only think about collecting that data, but we have to think about using that data and shining the spotlight on what it's going to mean to use that data and holding ourselves and our governments accountable for long-term policy action.
Thank you. Tara?
We talk a lot about gender data gaps, but sometimes the biggest gap is actually in political will. So I'm going to, advocate for that as well, that a lot of the things, we know that gender-based violence happens in crises. So let's just get the resources out to the organizations who are on the front lines of supporting women.
Thanks, Tara. And Papa?
Yeah, I think for me, it's basically learning the lessons of what we've missed. So why were we so unprepared in a lot of ways? And I think that's really going to be important, because it's countries will be opening up and will be addressing the consequences of this crisis, and that we cannot miss. So yeah.
Many thanks, Papa. And it looks like we are running short on time. So I just want to give a big thank you to Emily, Tara, and Papa, as well as Chris, for joining us today. And thank you also to our international audience. I think the conversation has been really valuable in terms of insight on how to use data to inform a gender-sensitive response to this pandemic. And please make sure to sign up for the other events in this gender data series on mitigating the impact of COVID-19 on women and girls. We'll be looking at how social media data can help tackle gender-based violence during COVID-19 next Tuesday. And for those of you whose interest is really piqued, I know that TechChange actually has produced a new free blended online course called Gender Data 101. And that may interest you. That starts May 18th. And information on how to sign up for that will be included in our post-event email, along with a recording of this webinar and, of course, a copy of Chris's amazing illustration. So in the meantime, thank you again so much for your time today. Stay healthy and well wherever you are, and all the best from Montana.